Outcomes for fetuses who are born with congenital heart disease vary quite a bit, mostly depending on what the original heart problem was, but also depending to some extent on if there are any other problems with the baby, birth defects, or whether the baby's born too early, and so forth. And so, in general, when we talk to parents about outcomes, we are assuming that the baby is going to be born without a lot of significant other problems, because that's the case most of the time. Usually when we see congenital heart disease, it is isolated to just the heart, and the rest of the baby formed perfectly well and normally in utero. So the outcome then depends on what the problem is. So for simple holes in the heart that can be surgically repaired, outcomes are quite good. Some of these holes will even close on their own, in which case we expect the outlook to really be quite good. But there's a range, and infants born with the more common types of heart problems like tetralogy of Fallot or transposition of the great arteries generally undergo one surgery sometime in early infancy and may need additional surgeries later on. However, they enjoy pretty good health in between surgeries and are expected to go to normal school and exercise and play with their peers at least. On the other end of the spectrum, severe heart disease with valves that either can't be replaced or chambers that don't form at all may require a series of up to 3 or 4 consecutive surgeries in childhood, and they may be significantly more limited than their peers.